those skills. Today, I'm going to show you two things. Two things I'm going to show you, right? So, those who are going to join this class late, they can watch the video, and you have to watch the video. And if possible, please share this video with your friends after this class is over. Okay, so listen to me. Recently, I told you there are certain very, very dirty passive voice, and we discussed that. We did a great discussion on that. The dirty passive voice, like for example, she was administered, and we have to write she was administered metformin, and you have to change this into. So I'm not talking about this one. This will change to metformin was administered. This is the right word. Metformin was administered, and you are not supposed to write she was administered. Completely incorrect. Don't do that. Okay. Another mistake that you commit is she was commenced. She was commenced. She was commenced on metformin. That is another mistake that is everybody is committing nowadays. Metformin. Metformin. Okay. So don't write this way. This is completely incorrect. You have to write metformin was commenced is the right one. Metformin. What has happened? Okay, metformin was commenced. This is a way. Don't write it. She was commenced on metformin. That is completely wrong. She was administered. Metformin is also incorrect. And the correct form is metformin was administered. Even this is also completely she was commenced on. It's completely incorrect. I'm coming to the main point. So listen to me. I'll be going to the next area where another set of passive voice is going to be our discussion today. So listen to me fully. Don't lose your interest in this one. She was commenced on metformin is completely wrong. And I also gave you the reason why these are all incorrect answers, incorrect way of OET language. They are not at all standard language. You can easily lose your score in this because of that. And also don't write she was commenced, she was administered, she was prescribed. Don't write she was prescribed. You should always write metformin was prescribed. Prescribed, that is the right word. So this is a correct one. So don't commit this mistake again. You have to be very careful about that. Okay, these are some of the errors that you usually commit. So never do that. But I'm not going to explain the reason for this because you know this already. Okay, so I'm not going to talk about this now. I'm going to talk about this one. Family migrated with a husband and 3 children from Vietnam to Australia. Okay, fine. Family migrated. Family was migrated. Husband. Okay, let's remove this one. Husband is setting up a business, sorry, a small import business. Husband is, okay, even this is also not going to help you.
Maria, application chair काम दुदा
She studies English at night school. She is studied. Some people write this way. She is studied English at school. Unnecessary mistake. They are working hard to adjust. Please listen to me completely. They are worked. They are worked hard to adjust. She underwent cesarean section. She was undergone. She was undergone cesarean section. Some of the very serious mistakes that you are committing these days. Passive voice, incorrect passive voice. She studied. I don't know how you are learning all these things. She was migrated. I will tell you the reason why these are wrong, and I will also teach you how to make them correct. Patient has not understood the has not been understood. Has not been understood. Another mistake that people commit. And after this, you'll understand. We removed her sutures. We are removed her sutures. We are removed. Incorrect. Suture lines healed. Suture lines are healed. Another blunder that you are committing. Okay, suture lines are healed. I tell you the reasons. Okay, Maybe you have to watch this video several times to understand this one. We are discharged. We are discharged. The mother and the child from hospital. We are or we were. Both are incorrect. She resists medical intervention in hospital due to language barrier. She is resisted. Some people write this way. She is resisted. She is resisted. Wrong. We found her lazy. We are found her lazy. We are found her lazy. Okay. Not taking care of the baby. She is refusing to feed the baby. She is refused. So this is the trend these days. She is refused. We are suspecting postpartum psychosis. We are suspecting. We are suspected. Suspected. We are suspected postpartum psychosis. Incorrect. She keeps her home unkempt. She is kept her. I think some of you are still having this confusion or you are writing this kind of language. She is kept at home. Okay. Last one. She remains mostly silent. She is remained mostly silent. He is remained mostly silent. So these are some of the mistakes that you may be committing, and I want to tell you how to improve your passive voice. Listen to me very carefully. I hope you will really listen to me now. Suppose this is 1 second. Just a second, please. Let's take two characters here. I'm taking two characters here. One is this is one of you. This is a person here. This is a man. This is a nurse. Okay, this is a nurse. Okay, let me make it simple. This is a nurse and this is a patient. Nurse and a patient. Between a nurse and patient, so many things can happen. Between a nurse and a patient, like a nurse can admit the patient, and again a nurse can discharge a patient, and again a nurse can transfer a patient. Again, a nurse can advise a patient. See, there are so many things here. Here, look at this one. The nurse is number one, A. Let's call nurse as A and the patient as B. A to B. A to B. Okay. So please find out the point what I'm trying to hear. Okay. Nurse is admitting the patient. Nurse is discharging the patient. Nurse is transferring the patient. Nurse is advising the patient. Here, in all of them, who is doing the action, please? Can somebody tell me who is doing the action?
Nurse.
Nurse is doing the action. Okay. And who is receiving the action?
Patient.
Okay. So, this is most important. When the action is done by somebody, but it is received by somebody else, only there we can use passive voice. But so in that case, I'm going to show you how to convert all of them. Have a look at this one. So nurse is admitting. Suppose the patient's name is Mr. Peter. Mr. Peter was admitted by the nurse. We don't have to say by whom. Again, Mr. Peter was discharged by the nurse. We don't have to say by whom. Mr. Peter was transferred by the nurse or by the doctor, by the hospital. We don't have to say by. Okay. So Mr. Peter was advised by the nurse or by the hospital. Okay, listen to me. These are known as passive voice. If you are confused, I can also tell you, some of you may be wondering, is it the only passive voice? No. Mr. Peter was admitted can be changed into has been admitted. Mr. Peter has been admitted is completely fine. You can write. Second one, Mr. Peter has been discharged is also fine. Mr. Peter has been transferred is also correct. Mr. Peter has been, that is also correct. 1 second, please. 1 second. Okay, sorry for the delay. Okay, so this is known as passive voice. So you told me that when the nurse is doing the action and the action is received by the patient, that means when person number 1, that is A, when A is doing the action and when B is receiving the action, only then we can use passive voice. And passive voice means basically what? Passive voice means was plus V3 form or is plus V3 form or has been plus V3 form or will be plus V3 form. And what do you mean by V3 form? I hope you know what is V3 form. The third form of the verb. Third form of the verb. For example, go, went, gone. Gone, gone. Okay, gone. Eat, ate, eaten. Or bring, brought, brought. Please stay here. Don't lose your interest and leave the class. It is very important. If you know passive voice very clearly, you can leave the class. I'm not insisting anybody to stay here if you know passive voice very well. Okay. Okay. Bring, brought again. Then undergo, undergo, underwent, and underwent. Sorry, undergone, undergone. Go, went, gone. Similarly, undergo, underwent, undergone. Same thing. Go, went, gone. Undergo, underwent. Okay. So these are the three forms. The third forms. Undergone is a third form. Brought is a third form. Eaten is a third form. Gone is a third form. Similarly, every verb has got a got 5 forms, and every one has got a third form. Okay. Now, coming back to the previous one, looking at this one, family was migrated. Tell me here, in this one, you can use passive voice only when the action is happening from A to B. She studied English at night. Tell me, second one, she studied or she studied? She is studied, which is better? She studied or she is studied?
She studied.
She studied.
Okay, I'll have to tell you something. They worked hard to adjust. Okay, I'll give you maybe a simple one. Apsara. Okay, Apsara. What? Served hot tea for everyone. Listen, please. Apsara served hot tea for everyone, or simply tea for everyone. Who is serving, please? Who is doing the serving?
Apsara.
Apsara. And what is she serving?
Tea.
And for whom is she serving?
Everyone.
For everyone. Okay. So there is A, B, C here. Or I'm giving another example. Alfonsa helps poor patients. Who is helping? Alfonsa. That is A. And she is helping whom? Poor patients.
Poor people. Yeah.
So Alfonsa's help is reaching the poor patients, or is Alfonsa helping herself?
He's helping.
Okay, that means from Alfonsa, the help is reaching B. Okay, in this one also, Apsara's tea is being served to everyone. It's not like Apsara is drinking tea, all the tea she is drinking alone. No, from Apsara, the tea is moving to B, A to B. This is, I think it is a very interesting class, very important class for everybody. Okay, I'm giving one more example. Nurses admitted Mr. Parker. Tell me, in this one, are nurses admitting themselves or somebody else?
Somebody else.
Somebody else.
So from A, it is moving to B. I don't know how many lucky people are going to understand that passive voice today with these examples. Another one, Jaswin slept during the class. Tell me, is the action moving from Jaswin to somebody else?
No, sir.
It is moving from A to A.
Yes.
There's no change. Okay, she recovered after 3 months. Tell me, is the recovery going from her?
No, sir. This is also it.
Yeah, it is A to A. It is A to A. Okay, she fell down. She fell down while walking. She fell down while walking. She is the one who is falling down, right?
Yes.
Did she fall on somebody or did she hurt somebody? Did she kill somebody by falling down? No. It is also A to A. Okay, then Jayamati understood the logic. Okay, Jayamati understood the logic. Here, she is doing the action. Jayamati is doing the action. Is she understanding herself or is she understanding something else?
Herself.
No, she is understanding a logic of something else, right? So there is a bit of A to B is here. So wherever A to B is there, you can convert them into passive voice. Now I'll show you how to. This is an A to B one. Apsara served tea for everyone. So everyone was served tea, or tea was served to everyone. But the best one is everyone was served tea. It's not important to write by Apsara. By is not important in many cases. Okay, so the first one we converted into passive voice. Second one, Alfonso helps poor patients. Poor patients
was helped.
are because it's helps, no? Right, present tense. There's no past tense here. Are helped by Alfonso. Poor patients are helped by Alfonso. Even this is also passive is possible. Nurses admitted Mr. Parker. Mr. Parker
Admitted.
was admitted. Yes, we don't say by nurses because everybody knows that. Mr. Parker, see, 1, 2, 3, all the three are converted into passive voice. Jaswin slept during the class. The class was slept by Jaswin during the class. What is that?
Was.
No, sir.
Anyway, okay.
During the class,
During the class, Jaswin was
during
slept.
the class, Justin was slept.
No. So remember, if the action is from A to A, if the action is not moving from A to A, we can never convert that into passive voice. So no passive is there. No passive. Okay, I'm coming to a very important conclusion. So please don't leave the class. 1 second, please. 1 second. All right. Okay. So when there is, okay, she recovered after 3 months. Here, she recovered somebody or she recovered herself?
Herself.
Herself.
Can we write she was recovered?
No.
She was recovered. Many of you are still writing she was recovered.
Yes.
This is a point I wanted to make. Please, everybody, please don't look anywhere. This is the most important part. I've been struggling to teach you the passive voice, and everything is going well. Our reading is going well. Our writing, everything is going well. Just one request, please try to understand this one. she was recovered is absolutely not possible. So then what to do? When you cannot convert something into passive voice, what to do? Then don't convert, that's all. It is not necessary that you have to convert in everything into passive voice. No, not possible. She recovered after 3 months is not possible. You have to write this way. So now I'm going to show you something. Okay, she fell down while walking. So can we say that she was fallen down?
No.
Can we write she was fallen down? I know you are saying no, but still you are confused.
Yes.
No, you are terribly confused. She was fallen down is completely incorrect. You cannot make this one. This is also no passive. I don't know how many of you are really lucky to understand this much so far. How many of you have really understood this much? Please raise your hands. I know it's not very easy to understand. I won't ask you any question. You can just simply raise your hands. Those
So
who,
now understand
yeah,
A to B and A to A. A to B means that is very easy to understand that if our action is going with someone, that is
yeah,
we can
yeah,
convert to passive voice. If it is A to A, we should not convert. So
yeah.
we mention
Simple.
same. That I
Same
understood.
thing, same thing. Okay, that's enough. That's enough. Don't shake your head. Okay, don't shake your head. You will forget everything now because it is so difficult to remember all these things. Oh my God, thank you. At least 11 of you have understood, but I am really concerned about others who did not understand. Blessy, Ida, Apsara, Jay Kumari, you have not understood names. No problem. I'm here and we will continue to understand all these things. Okay, Jayamati understood the logic. Jayamati is the person who is understanding. Is her understanding going outside of herself? It is inside her, right?
Yes, inside.
Jayamati understood the logic. Okay. Or I'll give you one more example. Jayamati, um, Jayamati, 1 second, taught me the logic. In the first one, Jayamati is the one who is understanding and it is only for herself. Second one, Jayamati is teaching somebody else. Jayamati taught me the logic. So here it is going away from A to B. I am the B here. I am the B here. So you can convert this into passive voice. Jayamati taught me the logic. I was taught the logic. Taught the logic by Jayamati. By is not important here. I was taught the logic. But can you write this one? Jayamati understood the logic. The logic was understood by Jayamati is grammatically correct, but in medical language, we usually don't write that one. So look at this one. Jayamati understood the logic. Who is understanding this one? Jayamati is understanding. And what is she understanding? The logic she is understanding. So there is a difference between this one and this one. Jayamati is the person who is teaching me, and that is going outside Jayamati. So that's the reason I was taught the logic is there. Whereas the logic was understood by Jayamati, nobody writes that way. Although this is grammatically correct, nobody is using this kind of passive voice. So there are two kinds of passive voice. Sorry, there are two kinds of sentences. Which are they? One of them is known as transitive sentences. Transitive. You don't like that, I know. Transitive sentences means A to B. Intransitive sentences are A to A. That means it doesn't go outside somebody. For example, she fell down. We cannot write she was fallen down. Or she went abroad. She went abroad. Abroad was gone by her. Is it right? Abroad was gone by her. So that's never possible. Transitive things like she narrated a story. She narrated a story. A story was narrated by her. She has taught me OET. She has taught me OET. OET has been taught by her. Or I have been taught OET. Both of them are completely fine. So passive voice. Now I'm coming to the conclusion of this one. In OET letter writing, can you tell me how many sentences do you usually write in passive voice in in an OET letter? How many minimum? Usually, how many passive voices do you write usually? Nobody knows? Okay, no problem. I'll do one thing. I'll give you a sample letter now. Passive voice thing will be very clearly mentioned here. Look at this one, please, all of you. I'm just sharing one of the letters that I shared in that group yesterday. I'm going to represent that same letter for you. Look at that one, please, all of you. Okay, I'm sharing it here in front of you. Have a look at this one. This is a letter which I shared yesterday. Mrs. Fletcher, can we write was underwent? No. So the first one is an active voice. I'm going to show you which is active and which is passive. Underwent a spelling is wrong. Laparoscopic surgery. Okay, this is sentence number 1. She was presented. This is passive or active? At least tell me that. Is it passive or active?
Passive. Passive.
She was presented by somebody. She was presented by somebody. Okay, maybe this is not here, but still you can understand. By someone. With complaints of acute menstrual, spelling wrong, menstrual pain in the lower left quadrant and occasional constipation. Mrs. Fletcher was hesitant to speak about her sexual history. This is not important here. On examination, a cyst was found. Is it a passive voice or active voice? A cyst was found.
Passive.
Found is someone has found.
By someone, yes, by someone. Okay, I'm just trying to show you that an OET letter is a combination of passive and active. And I'm also going to show you Mr. Fletcher underwent is a normal sentence that is active voice. She was presented is a passive voice. See, look at the differences here. A 6 centimeter cyst was found by somebody. Again, passive voice is here. Mr. Fletcher is recovering well. There has no passive or active here. She is well oriented, also doesn't have any passive or active. Okay, coming to the next one. Mrs. Fletcher is encouraged to have oral fluids. Is it a passive or active?
Passive, sir.
Is plus encouraged. Is plus ed form. So when you see is, was plus the V3 forms, it is a clear indication that it is a passive voice. Okay, Mrs. Fletcher is encouraged to have, see, Mrs. Fletcher is encouraged by whom? By someone.
Someone.
Okay, to have oral fluids and to mobilize as per tolerance. All the post-operative investigations are normal. This is not a sentence for that. Okay, Mrs. Fletcher can be allowed to bathe. No, this, okay, yeah. Can be allowed to bathe. Can be allowed. Is it a past tense?
Yes.
It is, sorry, it is passive voice. It is definitely a passive voice. To bathe in, don't write bath, it is bathe. Bathe from 13th March and can resume. Okay, and can, she can resume. Tell me, is she can resume passive or active? Resume is first form. So, he can resume driving. She can resume driving. How do you know it is passive or active? This is not passive, because if it is
Active.
passive, then the ed form should be there, right? The ed is not here.
Okay.
She can resume is a normal sentence 1. If you want to convert this into passive voice, driving can be resumed after 2 days. See, driving can be resumed after 2 days of her analgesics course completion. After 2 weeks, she can have normal sexual activities. After 2 weeks, she can have normal sexual activities. No, this doesn't have any passive voice or active voice. Mrs. Fletcher will be discharged. Yes, another one. Will be discharged. Is it a passive or active? How do we know it is passive or active? Ed is here. B is also here. So passive means
Passive.
To identify passive voice, I'll give you some hints. Everybody, I can give you some hints about passive voice. Basically, be will be there. Basically, the third form of the verb is always there in passive voice. No ing is there in passive voice. Sometimes being is also used here. Being is also used here. Been is also part of this one. Been for like has been, have been, has been, had been. Okay, and then is, am, or, was, were, will be, shall be, plus B3 form. This is basically passive voice. Which are they? Okay, 1 second. Be, be forms, being forms, and been forms, and is, are, was, were, will be, shall be, and plus V3 form. When these things come together, this is passive voice. I will show you. For example, can be allowed, passive voice. Can be allowed. Be is here. See, can be allowed. Is encouraged. Is plus encouraged. There is. See, is plus encouraged. Okay, was found. Was. Where is was? Was plus find, found, found. Was found. I hope you understand me. Okay. Was presented. Was is here and presented. Present, presented, presented. V3 form. Okay. So how to identify a passive voice is also very important one. How to identify? This is how you can identify passive voice. It will also have a few more words like can be, maybe, okay, can be, maybe, can be, maybe, must be, should be. These words are also part of the passive voice. That means if you understand only this much list, which are they? Be, being, been. I think you can remember that. Be, being, been. Right. And the forms of be are, which are the forms of be? Which are the forms of be? Is, am, are, is, am, are, was, were, will, shall. These are the forms of be plus P3. Easy. Being is, okay, standalone. Okay, so it is already mentioned. Then we also have got others like can be, maybe, should be, must be, all of them. So these are the only things that is known as passive voice. If you understand this much, easy. Okay, now driving can be resumed. Driving can be resumed. This is also another passive voice. Resumed by whom? By whom? By her. By her. Right. Mrs. Fletcher will be discharged. Will be discharged. Again, another passive voice. Will be discharged. By whom? Of course, by us, by you, by nurses. So, passive voice means this one basically, where an action is done by somebody else. That means there are two people. Mrs. Fletcher will be discharged. Like on one side, nurses to discharge her. On the other side, the patient to be discharged. On the one side, driving can be resumed by her. She is on the other side and she can resume driving. See, driving can be resumed. She can resume driving. Mrs. Fletcher can be allowed to bathe. Okay, so bathing can be allowed. Mrs. Fletcher is encouraged by someone. Someone is going to encourage Mrs. Okay, so everywhere passive voice is not that difficult for you, please. Okay, you have to stay with me for a few more minutes and things will be much beneficial for you till the end of, by the end of this class. Okay, so kindly provide future care and management. This is passive or active. Kindly provide future care and management. You cannot convert this into passive voice. Okay, then should you have any queries regarding Mrs. Butcher while she was under our care, kindly contact me is also contact me. That's wrong. Sorry, it was a mistake. Yours faithfully and all the things. So I was just giving you some of the samples, sample sentences of passive and active. Now I have a request for you. Please, some of you, please tell me some of the sentences. I'll tell you. You can open your notebook and from there, take any of the sentence that you wrote in the letter so that we can make a list of them. Please, I want your cooperation for this. Anybody, please speak it. Any sentence, I will tell you which is passive or active. Ida, you can speak. Apsara, you can speak. If you have a letter, Amita, you can speak.
Sir, post-operatively,
Mm-hmm.
the mother and baby showed good progress.
Okay, the mother and baby
Showed
showed good progress. Okay, so my question is it active or passive? Anybody can answer. The mother and the baby showed good progress.
active.
Active.
Can somebody convert this into passive voice? The mother and the baby showed what?
Progress.
Good progress. Okay, so
Was good, sir.
I'm converting into passive voice. Good progress was shown by mother and baby post-operatively. Post-operatively. This is a passive voice of this one. The mother and the baby showed good progress. Okay, so please, you have to stay here. Good progress. You know why I keep on asking you to stay here, because it is passive voice. The mother and the baby showed good progress is equal to good progress was shown by the mother and the baby. I'm giving you two options. You can tell me in a letter which one sounds better. The mother and baby showed good progress, or good progress was shown by the mother and the baby post-operatively. Which is better one? Which is standard?
First one.
First one is standard. Okay, that means you cannot write passive voice every time. Okay, all the time passive voice is not applicable. Okay, somebody else please tell me one more sentence. Anybody?
Suture lines healed.
Okay, sutures.
Lines healed well.
Okay, suture lines healed well. Healed well. Or you can also think about another possibility. Suture lines are healed well. Which one is better, please? Suture lines are healed well, or suture lines healed well? Before that, tell me, suture lines healing well. Is suture lines, is it A to B or A to A?
A to A.
Yeah, because suture line is not going to the ward and healing everybody. No, it is naturally happening. It is A to A. If it is A to A, can you convert this into passive voice?
No.
No. So this is again, I'm telling you, you cannot convert everything into passive voice. And OET doesn't require you to write every passive voice. Two normal active voice and then another passive voice. That is fine. And you don't have to follow that order. Whenever it comes, you can write. Whatever is better, you can go with that. Somebody else can read one more sentence, please.
Hello?
Yeah, tell me.
Sir, how about suture got healed?
Sutures got definitely, grammatically that is fine. Sutures got healed means, see, I'll tell you the reason why suture got healed is not a standard language. I can tell you with an example. Okay, I got my shoes repaired. Repaired by a cobbler. A cobbler. You know, usually, or I got my hair made by a lady saying, I got my hair made by a hairstylist. Okay, fine. See, in these two cases, can you repair your shoes yourself? No. So you want somebody to get for that. I got my shoes repaired means I got someone to repair my shoes, and that someone is nobody but a cobbler. I got my hair made by a hairstylist means I'm not an expert in hairstyling. So I got somebody. So I got means I got the assistance of somebody else. So the sutures got healed means it is not really standard language. This is actually a in the northern part of India, this kind of a language is very prevalent, but that is really not a standard one. Okay, you asked me this question. Who is that? The one who asked? Somebody Zoom user? Who was that? The one who asked me this question? You must be from this is
Nawang, sir.
who is that?
Nawang.
Okay, you're from? No.
Northern part, sir.
Okay. Yeah, really, because in the southern part there are so many mistakes, in the northern part there are so many mistakes. Okay, so it is a common thing. So please don't use the word the sutures got healed is not really standard one. Okay. Anyway, fine. We are moving to the next one. Please, somebody else read one of your sentences. So when it is A to A, don't try to convert that into passive voice. For example, she fell down. She was fallen down is completely wrong. Her sutures, her wound healed. Her wound was healed is completely incorrect. Her healed, okay. Her wound was healed by whom? Her wound was healed by whom? You cannot say. Her wound was, you can write, her wound was, you can say like trust. No problem, because nurses and doctors can do, human beings can do that. But healing is something that is happening naturally. Nobody can heal it. You can only apply medicines. Okay. If doctors and nurses are not there, then healing is not possible. But healing is something that happens naturally after as an effect of medication and treatment and all the other things. Healing is totally natural. So her wound was dressed is fine, but her wound was healed is wrong. So how to write? Her wound healed after 3 days. Okay, got it. Okay, I hope it's. Somebody please read another sample, another sentence from your letter.
Her symptoms are settled down.
Okay, very good example. Okay, her symptoms are or have. Okay, her symptoms are settled down is actually passive voice. Her symptoms are settled down by whom? Tell me, by whom? If you remove this have, this is actually passive voice. Are settled down. I told you, are. Here is are. Are plus V3 form. R plus V3 form. I did not say have plus V3 form, but have been is there, but have plus V3 form is not passive voice. Her symptoms are settled down is wrong. Her symptoms have settled down is completely fine. I know that you have a limitation to understand what I am saying here. Don't worry, you have learned everything. Okay, if you don't know passive voice, what is going to happen is you will commit a few mistakes. It's okay. But still, if you can try to avoid those mistakes, your score will go up to 400. But sometimes, depending on the one who is going to check your paper, you may lose some remarkable amount of mark. That's why I'm spending more time on passive voice, because everybody's, most of you are committing some mistakes. Somebody can create another sentence, please. A sentence which you think very complicated, please read it.
Injection penicillin convert to simplex IV.
Okay, who did that one? Who can do that action? Usually, who are doing this kind of action? The changing of the injection. Who do that? Nurses?
Doctor.
Doctors and nurses, okay. So that means it is done by somebody, right? When the action is done by somebody else, yes, you can write. So tell me the sentence once again. Injection.
Penicillin convert to
penicillin, okay. Penicillin
convert to
was converted to
IV simplex.
Okay, converted to. We don't usually convert the injection. Change it is the right word. Okay, convert means that's something different one. Okay, injection penicillin was changed to IV.
Simplex.
Spelling.
CEPLAX.
RALX.
LA.
LAX. Okay, sorry. Maybe whatever it is. Okay, I don't know. Fine. So injection penicillin was changed to IV. Once again, spelling, please. I would like to know that. Learn that. CE.
PLAX.
Once again, CE. PR.
P
uh,
PLAX.
PL.
Yes.
Ciplax. CE. Okay, anyway, this is not recognized by Microsoft Word. That's the reason. No problem. It's okay. But we cannot recognize that. Injection penicillin was changed to, this is okay, because what is the active voice? We, that means nurses changed injection penicillin to IV Ciplax. So this is okay because action is done by us. Okay, we changed what? We changed something else. We changed something else. We are the ones who do the change. A, and injection is the one that got changed. So A to B. So we can convert this into passive voice. How? How to convert? This is converted this way. IV Ciplax. Okay, I'll show you. IV Ciplax. We changed injection. Okay, Ciplax was. We changed injection to. Okay, sorry. Injection to. Sorry, we changed the what? Injection. Okay, sorry. Injection was changed to. Sorry, that I made a mistake. Injection was changed. Injection penicillin was, right? Injection penicillin was changed to IV Ciplax. Okay. See, this is it. Here, so this is also possible. So now, as a conclusion, before you all start sleeping, I want to tell you the conclusion. In OET letters, from the first sentence to the last sentence, you can use passive or active. But every sentence cannot be converted into passive voice. Some sentence should be written in passive voice. Some sentences should be written in active voice. You should know that. And then which kind of sentences should be written in passive voice? Those sentences whose by is known by everybody. By whom is known. For example, like Ciplax, you are saying, okay, Ciplax, I will learn what it is later on. Ciplax was administered. We know administered by nurses or doctors, right? We know that. So when you know by whom, we can simply write passive voice. Or she was, or simply the normal sentence, on 12th March 2023, 2022, Mr. John was admitted. John was admitted by 3 nurses, 2 doctors, 5 of the ward boys, and the driver of the ambulance, Mr. Ali. So is this much long sentence required? Full stop. Just kill them all. So this is how we use passive voice. Passive voice is written or used when we know by whom certain activity is done. Simply write, on 12th March 2022, Mr. John was admitted. By whom? Nobody is worried about that. Or this was administered. By whom? By whom? Why? Nobody wants to know by whom it was administered. So when you know by whom something was done, use passive voice. Okay, I hope you understood something about this one. Okay, now listen. Before we wind up the session, just 1 minute give me. Mrs. Fletcher underwent a laparoscopic surgery on 8th March 2000, okay, in our facility. Okay, then this sentence will come first. Mrs. Fletcher was presented with the complaints of acute menstrual pain in the lower left quadrant and occasional constipation. She underwent. She So if you continue this letter, she underwent a laparoscopic surgery on So you can see that a combination of passive and active voices will be there. The first one is a passive voice, and the second one is not a passive voice, and third one is a passive voice, and many of them are passive voice. And in between, passive, active. This is how a letter is formed. So you have understood what is passive voice. You have understood these things like here, this one's the one which I told you, this one, be, is, am, are, and when V3 comes with any of them, B plus V3, for example, B plus V3, okay, like here, it will be done, passive voice. She will be discharged, passive voice. She will be admitted, passive voice. So she is being transferred. See, transferred. Did you notice one thing? Everything, the verb is third form. She is being transferred. She has been discharged. See, these are the sentences that we frequently see. Okay, like she can be transferred to the ward anytime. She can be discharged anytime. Okay, so these are the passive voices here. I hope you understood something now. I will continue with the passive voice in the coming classes also, and you will understand that. Those who are beginners, you may not have understood something. So don't worry, we will work on that. So with that, I am winding up this session. I hope this class was beneficial for everybody. Having any question?
Yes, sir.
Yeah, please.
One last question.
Yeah.
If injection PCM convert to orally, so is it change or convert?
No, we cannot convert this. Convert means, what do you mean by convert? Convert means you are changing the ingredients of the injection, like whatever is the ingredient, it will be changed. That is conversion. Changing means you are just replacing or changing. You cannot, maybe in some hospitals, people use wrong English and everybody will be copying the same English. That is a common thing. So conversion is something else, conversion. Like a conversion means, for example, you are removing the potassium elements from this one or of a particular medicine, and you are adding more another chemicals. Like a conversion is basically the internal change, not the external changes. So we cannot use the word conversion. That is the only main problem here. Changed or replaced, you can write that. Changed is the best one. Everywhere, everybody is using changed.
Switched also better, no, sir?
Switched is also very good one. Yeah, switched on. Yeah, switched on. Yeah, you have to switch to. Okay, or she has to switch to another diet or something like that one. Yeah, shift to, switch to. Shift is good for she has to switch to a vegetarian diet. Shift to. Shift and switch are all right for these kinds of things. Even for medicines also, if it is a new different kind of like conservative medicines and you are using another kind of medicine, so there also you can write shift or switch to, but never use the word convert. Convert is something else.
Sir, one doubt, sir.
Yeah, please. Yeah.
In the requisition paragraph, above mentioned condition like that we should not use, sir?
No, we should not use. Yeah, we cannot use that one. OET has said that based on the above. So this is actually, we are writing a formal letter. Based on the above means
Mentioned.
the above mentioned or aforementioned, these two words are not really recommended by OET. Don't use them. That's why we have our own line. Remember, considering the current condition of Mr. No, that is the reason we invented a new sentence. So everybody is using that now. Considering, I hope you know that. Considering Mr. Peter's current condition. Okay, current condition. This is one of the best inventions we have made recently. Considering Mr. Peter's current condition, kindly provide. Okay, whatever you want to provide, just mention all of them here. Or also end the, okay, if you require any more information about Mr. Parker, while this is our style, okay, while he was under our care, comma, kindly contact me. This is a beautiful one. You can use it anywhere. You can use that because these are new things. These are new, and you will not commit any mistake. Safely you can write, and you will be getting a better score for this one. If you require any more information about Mr. Parker while he was under our care, kindly contact me. Some people, last thing, if you require any more queries, please go through this one. Do you find something wrong with this word here? Do you find anything wrong here? The word queries?
Yes. Like also we have some queries. So
Yeah. If you require some queries means if you
queries
need, yeah, you can just order some queries. If you require some queries means if you have like 10 queries, 20 queries, 1 kilogram of queries. So we can never use require plus queries will never come together. Require plus queries. If you want queries, okay, you can write. If you have any queries about Mr. Parker, but please don't use the word queries. In 99% cases, we don't use queries. Okay, if you have any queries, most of the cases you can avoid that. So if you have, if you need any further, information, that's the right word we use. Okay, so if you require any more information about Mr. Parker, that is the best one. Any other question, please? Do you have any queries?
Sir, for social worker,
Yeah.
do we need to mention first social background in the second paragraph, yeah, to expand the purpose for social workers?
No, we have to use medical always, emotional or psychological second. If there is no psychological, then you have to go to the lifestyle. If there is no lifestyle, you can go to the occupational part. Then you can go to the nutritional part like BMI, weight gain, weight loss. Only after that you can go to the social part.
Okay, sir.
I know that you don't agree with me completely, maybe, okay, but whether it is a social worker or whatever, every time the medical part is there. If the medical is not there, then emotional part should be there. Then there should be, so one by one. If there is nothing, then only you can start with the social part. Otherwise, MELONS. You have to follow that. Okay, that is the end of this session. See you tomorrow. Bye-bye.
Thank you, sir.
Good night.